Hello everyone. In today's video, we will have further discussion about some important questions regarding sterilization and disinfection. A set of questions and discussion already done in my previous video. You can check this out. Link has been shared in the description box. So let's start today's session. The first question. Ethylene oxide destroy microorganism by mechanism option 1 alkylation, option 2 oxidation, option 3 protein denaturation, and the option 4 is none of these. And the correct option is alkylation. Ethylene oxide is alkylating agent and exert its lethal effect on proteins of bacteria. It is active against all types of bacteria and spores. It has good penetrating power even through the plastic. Plastic goods, polyethylene tube, artery and bone grafts, cytoscope, culture media and vaccines can be sterilized by ethylene oxide. Next question. Phenol coefficient indicates option 1 efficacy of a disinfectant, option 2 dilution of disinfectant, option 3 purity of disinfectant, and option 4 quantity of disinfectant. And the correct option is efficiency of a disinfectant. Now, what do you mean by phenol coefficient ratio? Basically, phenol coefficient ratio is the concentration of phenol that kills microorganism in 10 minutes, not in 5 minutes, divided by the concentration of disinfectant that kills microorganism in 10 minutes, not in 5 minutes. Or more popularly, it is mentioned as the greatest dilution of disinfectant that kills microorganism in 10 minutes, not in 5 minutes, divided by the greatest dilution of phenol that kills microorganism in 10 minutes, not in 5 minutes. Next, which one is incorrect statement? Here, the different statement regarding phenol coefficient is mentioned, and you have to choose the incorrect or the false statement regarding the phenol coefficient. So the options are, first option is, if phenol coefficient is 1, then the test disinfectant is as effective as phenol. Option 2, if phenol coefficient is more than 1, then the test disinfectant is more effective than phenol. Option 3, if phenol coefficient is less than 1, then the test disinfectant is as more effective than phenol. And option 4 is none of these. And the answer is, if phenol coefficient is less than 1, then the test disinfectant is as more effective than phenol. That is, this statement is the incorrect statement. So, phenol coefficient is used to testing the efficacy of a disinfectant. So, if phenol coefficient is less than 1, then it means that the test disinfectant is less effective than the phenol. Phenol is an organic compound that is mainly it is weak acids. Phenol also known as carbolic acid. Next question. Sterilization control of radiation is option 1 Bacillus Thermophilus, option 2 Clostridium tetani, option 3 Bacillus pumilus, and option 4 is Brevandimonas diminuta. And the correct option is Bacillus pumilus. That is, for radiation control, Bacillus pumilus is used as biological indicator. Whereas in autoclave, Bacillus Thermophilus is the biological indicator for sterilization control. In hot air oven, Clostridium tetani or Bacillus subtilis or Bacillus atrophicus is used as sterilization control. In filtration method, this Brevandimonas diminuta is used as sterilization control. Whereas for gas sterilization, Bacillus globigii is used as sterilization control. By pasteurization, option 1 all the microorganisms can be removed, option 2 only pathogenic form can be removed, option 3 only non-pathogenic forms can be removed, option 4 all of these are correct. And the answer is only pathogenic forms can be removed. We know that the pasteurization is done below 100 degrees centigrade. That eliminate only the pathogens and extend the shelf life. Pasteurization is done below 100 degrees centigrade, that is, one is 63 degrees centigrade for 30 minutes, that is Holder method of pasteurization, And another one is 72 degrees centigrade for 20 seconds. That is flash method or pasteurization. Next, which disinfectant is used for control of staphylococci? Option 1 hexachlorophene, option 2 phenol, option 3 triclosan, and option 4 is all of the above. And the correct option is all of the above. That is, to control staphylococci, hexachlorophene, phenol, triclosan, all may be used. Staphylococcus is gram-positive bacteria. Phenol is active against a wide range of microorganisms including bacteria, fungi, virus, but it is slowly effective against spore. Whereas hexachlorophene is potent by bacteriostatic activity against staphylococci and other gram-positive bacteria. In medicine, it is useful as a topical and anti-infective antibacterial agent and often used in soap and toothpaste. Triclosan is an antibacterial and antifungal agent present in some consumer products including toothpaste, soap, detergent, surgical cleaning, treatment. Triclosan is an inhibitor of enoyl reductase. This allows to kill bacteria by inhibiting the fatty acid biosynthetic pathway, which in turn disrupt lipid biosynthesis and eventually kill the cells. Whereas hydrogen peroxide and sodium hypochlorite disinfectant are more effective against Staphylococcus aureus and Pseudomonas aeruginosa biofilm than quaternary ammonium compounds. Next question. Which one is an example of mechanical method of sterilization? Option 1 filtration, option 2 moisture sterilization, option 3 gas sterilization, and option 4 is dry heat. And the correct option is filtration. Moist heat and dry heat are physical method of sterilization, whereas ethylene oxide, glutaraldehyde, etc. are chemical method of sterilization. And filtration is the mechanical method of sterilization. Next question. Which of the following disinfectant is used to kill algae? Option 1 mercury chloride, option 2 silver nitrate, option 3 copper sulfate, and option 4 is all of the above. And the correct option is copper sulfate. This is very important question. Now, another one options are mercury chloride and silver nitrate. The mercury chloride used as disinfectant, antiseptic, fungicide, wood preservative. It kills both bacteria and fungi. Frequently kills also seed and plant material. It is highly toxic and corrosive to mucous membrane. Silver nitrate kills bacteria by different microorganism mechanism which are binding to the thiol group of protein and denaturating them, programs cell death, causing the DNA to be in condensed form. Next one. For surface sterilization of aseptic areas, which type of radiation is used? Option 1 is UV rays, option 2 gamma rays, option 3 is X-ray, and the option 4 is all of the above. The correct option is UV rays. That is, for surface sterilization of aseptic areas, UV ray is used. UV radiation is non-ionizing radiation. The microbial sensitivity of UV radiation is mentioned here. Bacterial spores are more resistant than vegetative cell to non-ionizing radiation such as UV. Viruses are inactivated and are more sensitive than spores. HIV not activated by UV radiation. UV is effective against MRSA, that is methicillin resistant Staphylococcus aureus, Clostridium difficile, influenza A virus. UV ray also used to disinfect water. UV radiation is used to disinfect closed areas like OT, wards and labs. Next question. Which disinfectant is used to kill endospore of anthrax bacteria? Option 1 chloramine, option 2 iodine, option 3 chlorine dioxide, and option 4 is ethylene dioxide. And the correct option is chlorine dioxide. Some chemicals such as formaldehyde, nitrous acid kill spores by DNA damage. 10% solution of household bleach, that is sodium hypochlorite, is widely used for decontamination of surface and tools exposed to biological agents including Bacillus anthracis. Sporicidal effectiveness of hypochlorite solution depends on available chlorine and pH. Bleach must be diluted with water to increase the free available chlorine and acid that changes to the pH. Hydrogen peroxide is effective against a wide range of microorganisms, including bacteria, yeast, fungi, viruses, and spores. What is iodophore? Option 1, combination of iodine and organic matter. Option 2, combination of iodine and inorganic matter. Option 3, combination of iodine and metal ion. Option 4 is none of these. And the correct option is combination of iodine and organic matter. Iodine bound to carriers such as polyvinyl pyrrolidone, that is povidone, or ethoxylated non-ionic detergent such as poloxamars. Iodophore is widely used for antisepsis of skin, mucosa and wounds. A 2.5% ophthalmic solution is useful prophylactic agent neonatal conjunctivitis. Next, which of the following disinfectant act by disrupting microbial membrane? Option 1, cationic detergent. Option 2, halogen. Option 3, heavy metals. And option 4 is aldehyde. And the correct option is cationic detergent. That is, cationic detergents act as disinfectant by disrupting microbial membrane. Whereas heavy metal combine with protein, often with sulfhydryl group, and inactivate them. They may also precipitate protein. Aldehydes act as antimicrobial agent by combining with nucleic acid and protein and inactivate them, probably by cross-linking and alkylating molecules. Halogens such as iodine kills bacteria by oxidizing cell constituent and iodinating the cell protein. Next, heating at 63 degrees centigrade for 30 minutes does not kill. Option 1, prion. Option 2, Coxiella. Option 3, spore. And option 4 is all of the above. And the correct option is all of the above. Coxiella kill at 72 degrees centigrade for 20 seconds, that is by flash method of pasteurization. Whereas spores killed by autoclave or tyndallization. Autoclave is the surest method to kill the spore, whereas tyndallization is fractional sterilization. It is a 3-day process that done at 100 degrees centigrade for consecutive 3 days for 20 to 30 minutes. Each day, that is day 1, day 2, day 3, each day is 100 degrees centigrade for 20 to 30 minutes. Prion kill at autoclave at 134 degrees centigrade for 18 minutes or more in a pre-vacuum sterilizer. Next question. Which disinfectant is used to disinfect blood spills in hospital? Option 1, sodium hypochlorite. Option 2, iodine. Option 3, betadine. And option 4 is alcohol. And the correct option is sodium hypochlorite. 1% sodium hypochlorite is used to disinfect blood spills in hospital. Sodium hypochlorite is commonly known as bleach, is effective against disinfection of virus, bacteria, fungi, mycobacterium. However, it is not effective against bacterial spore and prions. Next one. Which of the following chemical is used as disinfectant? Option 1, ethylene oxide. Option 2, hydrogen peroxide. Option 3, ozone. And option 4 is all of the above. And the correct option is all of the above. That is, ethylene oxide, hydrogen peroxide, ozone, all are used as disinfectant. Ethylene oxide kills microorganisms by alkylating the molecules, whereas hydrogen peroxide and ozone act as oxidizing agent and kill the microorganism by oxidizing the molecules. Next question. Which of the following heavy metal are used as disinfectant? Option 1, mercury chloride. Option 2, silver nitrate. Option 3, copper sulfate. And option 4 is all of the above. And the correct option is all of the above. That is, copper sulfate, silver nitrate, mercury chloride, all are used as disinfectant. Next one. Best method for sterilization of antibiotic and etc. is option 1, membrane filtration. Option 2, tyndallization. Option 3, autoclaving. Option 4 is radiation. And the correct option is membrane filtration. Fluids that would be damaged by heat, radiation or chemical sterilization such as drug solution can be sterilized by microfiltration using membrane filter. This method is commonly used for heat labile pharmaceuticals and protein solution in medicinal drug processing. Next question. Spores are killed by option 1, 70% alcohol. Option 2, glutaraldehyde. Option 3, autoclaving. Option 4, both 2 and 3. And the correct option is both 2 and 3. That is, spores are killed by glutaraldehyde or autoclave. Next question. Which factors on which disinfectivity of disinfectant depends on? Option 1, concentration of substance. Option 2, time of action. Option 3, pH of the medium and temperature suitable for the chemical. And option 4 is all of the above. That is the correct answer is all of the above. That is concentration of the substance, time of action, pH of the medium and temperature suitable for the chemicals. All are this is influence the disinfectivity or the disinfectant. Dry heat sterilization is used for option 1, sterilization of glassware, surgical instrument, option 2, bacterial endotoxin, option 3, sterilization of non-aqueous thermostable liquid, and option 4 is all of the above. And the correct answer is all of the above. Dry heat sterilization is accomplished by conduction of heat. It kills microorganisms by oxidizing the molecules. Dry heat lyses the protein in any organism, causing drying of cells, and can even burn them to ashes, such as in incineration. Next question. Which of the following is most resistant to sterilization? Option 1, Clostridium tetani. Option 2, prions. Option 3, bacteria. And option 4 is fungi. And the correct option is prion. Prion are misfolded or unfolded protein. That is, it has proteinaceous material. In general, prions are quite resistant to protease, heat, ionizing radiation, and formaldehyde treatment, although their infectivity can be reduced by such treatment. Effective prion decontamination relies upon the protein hydrolysis or reduction or destruction of protein tertiary structure. Antimycotics are option 1, used to treat and prevent mycosis, that is fungal infection. Option 2 is used to treat or prevent bacterial infection. Option 3 is used to treat or prevent viral infection. And option 4 is none of these. And the correct option is used to treat or prevent mycosis or fungal infection. Mycosis means fungal infection. Antimicrobial substance that destroy the virus particle known as antivirals or viricides. Next question. Which one is used to kill microorganisms present on body surface? Option 1, antiseptic. Option 2, disinfectant. Option 3, none of the above. Option 4 is both 1 and 2. And the correct option is antiseptic. Antiseptic is an antimicrobial substance or compound that is applied to living tissue or skin to reduce the possibility of infection, that is sepsis or putrefaction. Antiseptics are generally distinguished from antibiotics by the latter's ability to safely destroy the bacteria within the body, and from disinfectant, which destroy microorganisms found on non-living objects. So disinfectant are used to destroy microorganisms found on the non-living objects, whereas antiseptics are used to disinfect microorganisms present on the body surfaces. Next, what concentration of Cidex is used for endoscope? Option 1, 2%, option 2, 5%, option 3, 10%, option 4 is 60%. And the correct option is 2%. Glutaraldehyde 2%, glutaraldehyde is used as Cidex. Glutaraldehyde is used as cold sterilant to disinfect and clean the heat sensitive equipment such as dialysis instrument, surgical instrument, suction bottle, anesthetic equipment, ear, nose and throat instrument. Glutaraldehyde does not have any deleterious effect on lenses instruments such as cystoscope, bronchoscope, endoscope. So these instruments are sterilized by glutaraldehyde. Glutaraldehyde owes its biocidal activity to alkylation of sulfhydryl, hydroxyl, carboxyl and amino group that alters DNA, RNA protein synthesis. Glutaraldehyde is now classified as a disinfectant by manufacturer rather than as a sterilant. Therefore, its use on an arthroscopic and laparoscopic instrument is questionable. Next question. In membrane filtration method, filter membrane made from option 1, cellulose acetate, option 2, cellulose nitrate, option 3, polycarbonate and option 4 is all of the above. And the correct option is all of the above. That is, filter membrane that is used in membrane filtration method is made of either cellulose acetate or cellulose nitrate or polycarbonate. Thank you. Please like, share and subscribe to this channel.